Welcome to our August Researcher of the Month. I'm really delighted and honored to be presenting this to Dr. Rana McKay. She is just a phenom. Rana actually did her residency training at Hopkins, did her fellowship at Harvard Medical School at the Dana-Farber Cancer Institute, and she's regarded around the world as a foremost expert in kidney, bladder, and prostate cancer. Rana, congratulations.
Oh my God. Thank you so much, Monty, for that kind introduction. Just really standing on the shoulders of amazing giants in the field like you and others. So,
Well, we are going to try to dive right in here for a very brief intro. Tell us what your research is all about.
my research interests largely revolve around clinical trial design of novel therapeutics or novel therapeutic strategies for patients with advanced genitourinary malignancies, largely focused on prostate and kidney cancer. Additionally, my research has focused on translational aspects of biomarker development, whether that be blood-based biomarkers or tissue-based biomarkers to help guide therapeutic strategies. And I would probably say that I am a clinician at heart, and my heart is in the clinic, and there is no way to de-link my research from my clinical involvement. I tell my patients and my fellow colleagues all the time, I get all of my creative thought from being in the clinic and understanding our unmet clinical dilemmas. Why are some patients responding? Why are they not? Why does this group of patients do poorly? How can I better find the fact that this person recurred? And so all of our research questions that really drive me are really stem from the clinic.
So beautifully said. And Raina, if you had to kind of pick, you're doing so many trials, but if you had to pick like one or two that you're most excited about to tell our MOASC membership, hey, refer patients for study X, Y, and Z, what two trials would those be?
So I think the two trials that I would probably highlight are trials looking at novel modalities for patients with renal cell carcinoma. Um, you know, there's a lot of different strategies for us targeting, patients that have advanced disease. The first trial that I'm going to highlight is a trial called Radical. This trial is really focused at patients who have bone metastases from renal cell carcinoma. We know and we've demonstrated that those that have bone metastases have worse outcomes. They have declines in their quality of life and declines in their overall survival. And this trial is basically testing a drug that we know has activity in the bone called cabozantinib, which is a standard of care agent, with a radiopharmaceutical called radium-223 that is approved for use for patients with prostate cancer. And it is the first time that this agent is being tested in kidney cancer from the results of our prior pilot study that we conducted. And so I think this is really pushing the field forward with regards to novel treatments with very novel mechanisms of action. The other trial that I will highlight, and I will say for that trial, it's a cooperative group trial run through the NCTN. It is a bread and butter, homebred, a study looking at testing this agent, in this disease setting. The other clinical trial that I will highlight is a trial called Samurai. And this trial, there's been a real shift in the way we treat patients with metastatic kidney cancer over the last 5 years, really with the results of the Carmina trial coming out. Patients are not necessarily being considered candidates for cytoreductive nephrectomy up front. The strategy has been to kind of get systemic therapy in and get it in quickly so that we can improve outcomes for patients. And what this trial is doing is actually testing the role of radiotherapy to the primary tumor given concurrently with immunotherapy for patients with RCC. This is the first study being conducted through the NCTN of a radiation therapy in kidney cancer. So I think these trials are novel because they are introducing new therapeutics with novel mechanisms of action and modalities for treating kidney cancer.
Terrific, terrific. I mean, I think if I had two takeaways here, I'd say think Rana McKay for clinical trials and to remember those radical samurai, Rana McKay, the radical samurai.
There you go.
Congratulations to our August MOASC Researcher of the Month, Rana. You're so deserving of this and look forward to seeing you in person soon.
Thank you, Monty.